Chad has had some pain in the front of his hip. He's having difficulty bringing the knee up to the chest. So when he's playing guard or guard retention drills or even rolling, he's having a hard time bringing his leg up. So what we're going to do is we're going to use this voodoo band to kind of help the tissue kind of loosen up. And I'm going to show you one exercise with the voodoo band that's going to help with that hip flexion or bringing the knee to the chest. So what we're going to do is you go right to the hip as close as you can to the groin area. So move the furniture. Move your stuff. Alright, so let's go right under there. So we go pretty snug. I like to give it a nice like a nice pull. Every time I go around, I kind of give it a little bit of a pull. Just like that. Make sure you don't have any kind of like numbness or tingling in your leg from this. I mean, it's probably too tight or you need to take it off. I'd say, you know, don't keep it on there for long, about 3 to 5 minutes maximum. Okay. So you can do some general movement with this. You can lay down on your back. So Chad, to work on bringing the knee to your chest, let's lay down first. We'll do a couple of things. So Chad can just lay down, bend both knees up, just kind of bringing the knee to the chest. He can kind of help with his hands, bring it up, just where it feels a good stretch. I like to hold 5, 10, 15 seconds. You can work a couple different planes, out to the side, even working kind of inward a little bit, get some of those different angles. And then, so if Chad's having a hard time activating these muscles, like the hip flexor muscles, to bring his knee up, so the way we're going to do that is we're actually going to go to any wall or any kind of area where we can kind of hold on. And so what Chad's going to do is actually get in a good squat position, feet about shoulder width apart, slightly turned out, widen your feet just a little bit. And then he's just going to gently descend into a squat as far as you can comfortably. Just go as far as you can, good, and come up. So you can start a lower range, then gradually work your way down. So if you think about it, those hip flexor muscles aren't working right now, and he is getting the hip flexion. You're almost tricking the hip into bending without actually actively bending. He's using gravity to lower himself down to get some hip flexion. And if you can go lower, you can go lower with that. Good. Chad, get a little closer to the, right there, yep. And just bring your butt down your heels. Good squat mechanics, guys. And if you can go a little lower, you can go lower. You can sit there for a second or two if you'd like, and then comes up. Just like that. And what that's going to do is going to help loosen up some of that tissue in that hip joint. It's going to help with bringing the knee to the chest and help with hip mobility. So.